Pregnant women should get the vaccine. It's recommended that they get vaccinated in pregnancy by the American College of OBGYN, by the CDC, as well as the Society for Maternal Fetal Medicine. There are no risks from the vaccine. There are certainly risks from COVID in pregnancy. There's currently a study that's undergoing now where they're reporting the pregnancies with the vaccination, and of those 5,000 pregnancies so far, no complications have been reported. And they're looking at things like preeclampsia, gestational diabetes, birth defects, and there's no increased risk for, and I think that's important, there's no increased risk of death, neonatal death, no increased risk for malformations, birth defects, compared to women who are unvaccinated. So I think that's important information. If you get COVID during pregnancy, your risks of being hospitalized and being in the ICU are greater. Your risks of dying are greater. The risks of being vaccinated are minimal compared to the risks of getting critically ill during the course of pregnancy. So, the Moderna and the Pfizer vaccines are messenger RNA, and they have the ability to allow the cells to manufacture the spike protein, which then allows the immune system to produce antibodies directed against COVID-19. What it is not is live virus. What it does not do is change your genetic makeup. It does not enter the nucleus. It doesn't change our genetic makeup at all. It does not cause birth defects. It does not make us infertile. There's no evidence showing that. It is not associated with infertility. So women who are contemplating pregnancy can get the vaccine. And women who are pregnant should get the vaccine. Women who are breastfeeding should get the vaccine. The benefit is that the antibodies cross the placenta or in the breast milk and confer immunity to the baby. And that's an upside, a big upside for getting vaccinated while pregnant or breastfeeding. They should talk to their provider, and they should not be discouraged. And there's a lot of protective benefit from that. But we have a lot of information about women who are vaccinated in pregnancy. Their babies are normal. There's no increase in birth defects. There's no increased risk of complications or death if you get vaccinated in pregnancy. So the alternative is getting COVID in pregnancy, and that increases your risk of being admitted to the ICU, of being put on a ventilator, and potentially dying. There's no downside to getting vaccinated when you're pregnant. And lastly, the one, by getting vaccinated in pregnancy, it protects not only the patient, but her baby, but her family, and it helps put an end towards the pandemic.